Alright, so we're gonna do some more Anki Flashcards. So platelets derived from, just so you know, it's megacardiocytes. Now a plasmin, what does that convert? It's a FDP. It converts a fibrin clot to FDP and D dimers. What intermediate allows the GP1B receptor on platelets to attach to subendothelial collagen? So that would be your von Willebrand factor. Now, what finding on peripheral blood smear will be seen in DIC? So that's schistocytes. A streptococcal protein that activates plasminogen is streptokinase. Endothelin causes I think it's constriction. That's right. A molecule causing cross-linking of fibrin mesh is your factor 13. 13 does that. Now, a fibrinogen stored in dash granules of platelets, alpha stores fibrinogen. Von Willebrand factor, platelet factor. Platelets, where are they stored? Is it ADP stored? It's the dense granules. Alright. What converts fibrinogen to fire? I think that we just talked about plasmin. No, it was thrombin. Now, platelets, where can you find von Willebrand factor? Alpha granules. Now, what is the major activator of the coagulation system? That is found on subendothelial cells. Okay. Major activator of coagulation system. If you see subendothelial cells, you'll have a tissue factor. So, what is a life-threatening autoimmune side effect of heparin? So, a life-threatening side effect could be HIT. So that kind of makes sense. All right. So that's kind of cool, right? So all right. Now, a bradykinin, that is, I hope it's a constrictor, it's actually a dilator. Now, is it carrier protein 4? Ooh. Factor 8? Alright, that's kind of weird. Now, activate protein C and activates what clotting factor? So there's factors 5 and 8. Now, factor 10 to 10A. That's by 7A. So if you look at 10 to 10A, it's by, oh, that was 8A. So tissue factor 7A. Okay, so 7A goes and does that shit. Okay. What binds the platelet P2Y12 and what leads? I remember clopidogrel. ADP goes and binds to like your PTY12 receptor. All right. Now a failure of bradykinin, that's just your failure of degradation. What can fail it? So you got ACE inhibitors, you got hereditary angioedema, a powerful platelet activator, which is the basis for aspirin therapy, is your, one second, what is it? We're looking at thromboxane A2. So a skin finding in patients with protein C deficiency. That's your warfarin, skin necrosis. Streptokinase is streptococcal protein. What does that activate? That activates plasminogen. Okay. So yeah, it does activate plasminogen. When antibodies bind to like platelet factor 4, the heparin complex, what process occurs? It's called thrombosis. You get like thrombocytopenia. Basically, what they're asking is what happens when this heparin-induced thrombocytopenia occurs. A race which has disposition to this, I think it was Caucasians. Okay, no, that was totally wrong. Now, heparin activates. It's an antithrombin. Antithrombin. Main molecule that breaks down a fibrin clot is your plasma. Alright, so plasma does that. Now, what can lower the levels of homocysteine in the blood? I think that was folate. Okay, folate can lower the level of homocysteine in the blood. Now, which antibody in antiphospholipid syndrome causes a false positive RPR-VDRL? That would be your anti-lupin or anti-cardiolipin? Which one was it? It was anti-cardiolipin. That's the one that causes it. Okay. And then, what analog of ADH can be used to treat hemophilia A? That's your desmopressin, so that treats ADH and essentially just treats hemophilia A. Now, which antibody in antiphospholipid syndrome causes an increase in PTT? So that's your lupus anticoagulant. Okay, all right. Factor 5 latent mutation causes what pathology? What is the pathology here? It is resistant to inactivation by protein C. Okay. That's what actually happens here. It becomes resistant to inactivation. So you want protein C to inactivate it. That's what you're trying to say. Okay. Now, a lupus anticoagulant binds to dash to cause an increase in PTT. That's your phospholipids. Now you got phospholipids to cause the increase in PTT. Okay. Treatment for hemophilia A is, so you got desmopressin plus factor 8 concentrate. Okay, that's really what you get here. Now, what binds here induces a GP2B3A expression? That's your ADP. So, what are the vitamin K dependent? I remember 2, 7, 9, 10. And also protein CNS. I think it's something important. I think these two I always never really care about. It's a bad habit. I'm pretty sure they're going to test me on it. So, a serum levels of which amino acid is associated with hypercoagulable state? So, it's your homocysteine. Okay, that's really what happens there now. It's a platelet activate thromboxane A2 after aspirin blocks the synthesis of which mediator platelet activation? That's your thromboxane A2. Adhesion of causes platelet. So, adhesion of platelets, it stimulates platelets to release calcium. Why? For coagulation, ADP, and thromboxane A2. So you got three things there. That's important. Now, platelet phosphodiesterase inhibitors, okay? That leads to, what does it do? Increase this CAMP? Usually it should increase it. If you're inhibiting it, it decreases. Wow, I'm wrong. I'm totally wrong. Wow. An inhibitor should actually, wow, it actually increases it? That's insane. Will PTT resolve? Okay, forgive me, I'm yawning. In antiphospholipid syndrome during a mixing study. Okay, so we're looking at no. A mixing study, I have no idea. I have no idea what that is. Now, hemophilia B is a deficiency of factor 9? No, it's 10. Is it 10? I'm trying to remember. 12? I don't remember. This is 9. A is 8. Ah. Now, von Willebrand factor to receptor. Undergo adhesion. P binding. What does it do? It's basically von Willebrand factor. It binds to GP1B. Alright. Now, hemophilia A, that's the deficiency, factor 8. Antiphospholipid syndrome causes a false positive to which disease screening test? I remember reading it was a lupus, no, it was a cardiolipin thing. It was VD, yeah, RP or VDRL. So a vitamin K deficiency, that'll cause what abnormal hematological tests? So you get like an increase in PTT. That's what you get. All right, so you get increased PTT, increased PT as well. All right, that's if you're deficient. What is the renal cause? Antithrombin 3. Let me guess. Nephrotic syndrome. A platelet disorder involving a functional deficiency. GP2B. Also, you got 3A. Platelet disorder. So we're looking at Glanzmann thrombasthenia. All right, we're gonna go through Glanzmann thrombasthenia. All right. Now, in platelets, ADP binding to P2Y12 receptor induces dash expression. So, it's 2B3A. Really, that's what we're doing. It binds to P2Y12, and yeah, it does that. Now, it involves a defect in platelet aggregation. It's really what it is. It's platelet aggregation. Genetic inheritance of hemophilia B is X-linked recessive. Prothrombin 20210 causes increased prothrombin. Now, it's deficiency in 8. Genetic inheritance of just hemophilia C, so that's your autosomal recessive. The bleeding time will be normal in A. You got B, that's deficiency factor 9. Genetic inheritance. Hemophilia A is X-linked recessive. Okay, that's pretty cool. A is X, and then B is I think autosomal. No, that's also recessive. C is autosomal. A desmopressin is used to treat it's von Willebrand disease. You also have hemophilia A in that mix, so it's important. Von Willebrand disease. It makes sense. Desmopressin is it's not exactly. It's used in SIADH. I know that for a fact. Okay, an analog as we got is your desmopressin. Now, von Willebrand factor stored in where Weibel Palade bodies. That's your endothelial cells. It's important for cofactor activity protein C. That's protein S. They're always like co-linked, protein C and S. Now, what do you want to add to plasma to really test PT? You add tissue, factor, and calcium. All right. Now, a binding of ADP to like a platelet, I think that would increase. No. Why would that decrease? I don't get it. Why? Why would you do that? I don't know. Heparin induced formed against a complex of dash. So platelet factor 4 and heparin. Okay. It's produced by endothelial cells megakaryocytes. P2Y12, you got so aggregation factor 12, lifespan platelets is like 8 to 10 days. This rate increases in response to inflammation. Was added to plasma to test the PTT. Charge, you got silica, phospholipid, calcium. Average mediated by the GP2B. You got a 3A receptor. You have it. Now, what do you have here? Kallikrein converts dash to dash. High molecular weight kininogen. Now, A2 converts phospholipids to arachidonic acid. ADP platelets leads to CMP, X-linked recessive. Protein C deficiency is causes a warfarin skin necrosis. Okay. All right. Then, kallikrein. So that drives the production of platelets. Okay. Okay, so then thromboprotein drives production platelets. Now you got thrombocytopenia, renal symptoms. So we have antiphospholipid. So you got recurrent fetal loss. That's kind of cool. Mixing studies as lupus anticoagulant. Alright, and just like that, I'm already like kind of bored. Okay, so we're gonna